Ask yourself, what's one thing that you could scale right now? And I want you to give it a little bit of thought. So, scaling can mean something very different for you depending on where you are on your journey. And there's a whole lot of in between. Greetings, everyone, and thank you for joining me on this episode. Welcome to the Public Health Entrepreneurs Podcast for visionary leaders who are ready to transform public health and healthcare through innovation. I'm your host, Dr. Charlotte Huntley, and as a public health entrepreneur with well over 25 years of experience in healthcare and in public health, I understand the unique challenges and opportunities that come with bridging multiple disciplines. If you are an interdisciplinary professional, a high functioning leader with expertise across different fields, then you really know well what it's like to see opportunities that others missed. You also understand that what the current gaps are in our systems, and you have a lot of ideas about how to make things better. But sometimes having this unique perspective, as you know, can feel a bit isolating and even a little bit frustrating. You may even feel a bit divided across your different disciplines or fields of expertise. I completely understand. I also want to be a source of encouragement for you. So on today's podcast, we are going to specifically talk about scaling your impact. Let's first talk about what does it mean to scale. So the essence of scaling in business is finding ways to handle the increased demand for your products or services. In other words, more customers and clients without significantly adding to your systems or overhead costs. So scaling is really about achieving long-term profitable growth, not just a quick burst or spike in your algorithm or your charts. All right. So as we normally do on these Monday episodes, let's start off with setting an intention for the week. Try this on and see how it fits with you, or how does it feel with you. This week, I think beyond individual impact to system-wide change, I recognize that scaling my solutions can multiply my contribution to public health. How does that feel? Well, I only have one reflection question for you this week. Only one question. And it's this. Ask yourself, what's one thing that you could scale right now? And I want you to give it a little bit of thought. It means something different to everyone. It also means something a little different depending on where you are on your journey. I'll give my own example here. At the very beginning of my journey into entrepreneurship, especially under this public health umbrella, I started with a podcast. I started building a community. I was also working another job full time. There became an increased demand from people who were listening to the podcast and who wanted to work with me one-on-one. And while that's a really exciting thing to have happen, it was also creating a bit of a problem because I didn't have the ability to meet with the people that wanted to meet with me and operate my business and work my full-time job. So I looked for ways to scale and be able to show up and be there for people who wanted to work with me beyond the podcast while still being able to maintain my responsibilities with my work and so forth. A little bit later in my career, after leaving that job and working full time in my own business, it became another issue when I thought about scaling. Scaling meaning, how am I going to serve more people beyond what I can actually handle myself as an individual epidemiologist, individual consultant? Well, then I started looking at building team members so that people can take on some of the responsibilities and it's not just me, which allowed me to be able to serve more customers and clients and have a larger impact. So scaling can mean something very different for you depending on where you are on your journey. And there's a whole lot of in between. So that's just kind of putting it a little bit into perspective for you, hopefully. I want you to prepare for the next episode. On the next episode, I want to do a deep dive into scaling, and I want to include a few topics. We're going to talk about identifying opportunities for broader impact. We're going to talk about systems thinking and public health entrepreneurship, building scalable solutions, managing growth while maintaining quality, and creating sustainable business models. I'll also share 3 specific strategies with you in the next episode. So make sure you bring your pen and paper, your digital notebook, have the Google Doc ready. I want you to prepare to take some notes on the next episode. I think it'll be really insightful and helpful for a lot of you. Remember, setting an intention for the week will help you create a framework for how you want to experience your week. Setting intentions also help you stay aligned and maintain focus on what really matters most to you and your business. If you are ready to work with someone more closely to fully explore what's possible for you and for your vision, I invite you to consider working with me as a public health entrepreneur who works with high-functioning, interdisciplinary leaders. I provide the trusted soundboard and guidance that you might be looking for. Feel free to reach out to me through our website, which is Public Health Entrepreneurs. You can explore opportunities for working together more closely, or just reach out to us through the Contact Us page and submit your request that way. All right, everyone. Until next time, have a fantastic rest of your day.